Caroline, a yoga teacher with a special interest in menopause based in Edinburgh.
And hi, I'm Dr. Claire, a GP with a special interest in the menopause based in London.
Together with the Menopause Sisters, and today we're going to guide you through the terminology of perimenopause, menopause and post-menopause.
So I suppose one of the things that we should clear up is what the perimenopause is, and it's a term that is I guess relatively new, and lots of people may not be clear around what that is. Essentially what the perimenopause is this transition up until when your periods stop. So this transition can start in your early 40s and it can last anywhere between 4 and 10 years. And it's often when you might be experiencing some symptoms of the menopause, which we'll talk about a bit later. And these symptoms, as I said, can last anywhere from 4 to 10 years, but as we know, we're all very different. So some women have a shorter transition up until their periods stop. So when a woman's periods stop, that's technically a retrospective diagnosis when we can look back and say, we've not had a period for 12 months. And it's on that day that we can say we have reached the menopause. After this, we're postmenopausal, and we're postmenopausal for the rest of our lives. And that is really important to remember, because with the postmenopausal status, our levels of hormones are deficient, they're very low, and that can cause long-term health risks, which we'll also come on to at a later date.
There are illnesses and treatments and surgical procedures like a hysterectomy that can plunge a woman into post-menopause.
And some of these include cancer treatments, or for example, if you've had your ovaries removed due to a procedure or a cancer, this can plunge you into the menopause at an earlier date. So we do know that there is about 1 in 100 women that have an earlier menopause below the age of 40, and up to 1 in 1,000 women that might have a menopause earlier than the age of 30. But there are sometimes teenagers too that have an earlier menopause, and we mustn't forget to start talking about this and thinking about it and normalising the subject so that we're all familiar with what some of the symptoms might be.